The course is aimed at healthcare providers. They could be nurses, they could be doctors or allied health practitioners, it could be psychologists, anybody who works in physical or mental health care, but also policymakers, people who implement programs at scale within the sort of health and social care environment, scientists who study and researchers who study implementation processes and scale-up processes, and of course patients and service users.
I work in projects and programs, and implementation science, implementation is something that we do all the time, and I wanted to get a little bit of an understanding of what is the science behind this.
This is one of the key motivations for the field of implementation science, the idea that we have many new discoveries, many innovations, and we don't receive the benefits of those innovations in terms of improved health and lengthened life because of the so-called implementation gap.
A lot of people are quite alienated by the idea of applying theory. It seems too academic, too impractical. But actually using theory is a really typical innate human property. We all do it all the time, whether we're aware of it or not.
This is not just about academic research.
The networking, so many people here from so many different disciplines and different studies, that's been really useful.
I really actually like the breakout sessions where we're in smaller groups. It's a chance to chat in a little more detail about specific things. I think they're also really quite targeted to things that are really important.
I think actually people are starting to think more about how we really find ways to bring implementation into a more kind of engaged way of working.
I think the Masterclass will help me in my work by providing experiences from other people in the same boat. We tend to scale up within sort of the voluntary social care sector, so taking some of that learning from the healthcare settings is going to be really useful for us.
Implementing services and evidence-based practices that actually make our patients better is something that maybe most of us don't really think about on a daily basis. We just take protocols and policies and use as they were, and there's actually a lot of thinking that goes behind it, and that's something that I think I would take into work.
This type of masterclass is going to be imperative because what it means is I can take what I've learned and take it back home and help others.